Firstly, I'd like to thank Haresh and Krishna for inviting me here today. It's a great pleasure to be here kind of talking to you all. How many of you guys in the room are surgeons of interest? Oh, the minority, good. All right, so my name's Andre. I was a general surgical trainee in the London Deanery. Sanjay and Krishna both used to be my bosses. I have to say that they were the best bosses ever, of course. Catch me for a... So I graduated from Imperial back in 2004. My PhD, as PhDs go, was completely unrelated to what I do now in bioengineering. And in the interest of full disclosure, I'm a co-founder of a healthcare technology company called Touch Surgery, which I'll come on to kind of towards the end of my talk. I've been asked today to talk about really the challenges of teaching surgeons kind of in the new millennium and how things have changed. So I think when we talk about teaching the new generation of surgeons, it kind of goes beyond the individual. And this is the way that kind of we've approached things. And I think we all need to acknowledge that the world today is not the same that it was 10, 20, 30 years ago. And in terms of surgery, what I'm talking about is the fact that surgery as a profession has changed immensely. Patients themselves have also changed dramatically. And obviously, surgeons have changed. And from our point of view, a lot of those changes are actually driven by advances in technology. And these are advances, obviously, within surgical technology, but also technology that affects kind of the wider global scale. And so let's go through a few of those. Firstly, I think we can all acknowledge that surgery today is much more complicated than it ever used to be. I remember when I was kind of entering med school, trying to understand what a hernia was, reading that people fixed hernias with sutures, Bassini repairs and Schultes repairs and so on. By the time I left med school and Sanjay and Krishna were training me, I was learning how to do a mesh repair. Similar sort of technique, but very different principles. By the time I actually entered my registrar training, suddenly everyone was trying to do laparoscopic surgery. And actually there are two types of laparoscopic surgery. You can do TEP, and I'm sure in the future we'll be doing notes, single-site laparoscopy, and who knows what's going to happen with robotics now that Google's getting involved. So essentially, one relatively simple operation that really any medical student should know about, and we've gone from one way of treating it to maybe 7. And as a practicing surgeon, essentially, you should be able to offer multiple types of treatment to your patient when they come to you. So, just an example of how surgery is becoming even more and more complex. So what does this mean? Well, that means that surgeons today require a much greater array of knowledge than they've ever needed to, right? I don't think that we can get away from that. And with that, it means that there's an even greater need for really effective and high-quality training. The need for improved surgical training has never been greater than it is today. If only it was that easy. So, during my time at Touch Surgery, I've had the real pleasure of traveling around the world, visiting many centers, in the US, Asia, Europe, and so on, and talking to the educators there about the challenges that they face, training the next generation of surgeons. And a lot of them obviously have very specific complaints to their own institution and so on. But the complaint that comes up over and over again is really about how surgery as a whole views the importance of training. And unfortunately today, because of budgetary constraints and so on, training always comes a distant third behind service provision and academic output. Now obviously, this leads to an incredible imbalance between a huge need for great surgical training, but at the end of the day, no priority and no budget for it. So obviously something has to change. And when I talk about change, I'm not even talking about just changing surgical training for the benefit of us here or down the road at Imperial or over the pond at Harvard and Stanford, but I'm really talking about global change. I don't know whether any of you have read the recent commission by The Lancet on global surgery. Anyone? If you haven't, I recommend you read it. It's long, but worthwhile. There are 5 billion people on the planet without access to safe surgical procedures. We are over 1 million operations a year short of providing minimum standard of surgical care. And basic surgical pathology counts for more mortality than AIDS, HIV, TB, malaria combined. There's been an increasing recognition that the way in which we deliver surgery and train the next generation of surgeons really has to change. And I think we can all agree that the way in which we train surgeons at the moment just really can't scale up to meet that need. So it's up to kind of us as a medical community to figure out really what is the best way forward. So the crisis that I'm talking about really, you guys will know about the European Working Time Directive. Surgeons nowadays get much less time in the OR. There have been many studies around showing about how, number of hours spent in the OR drops from down to 50-30% of what it used to be. More and more surgeons now are reaching the end of their training and then realizing that, hey, I need to spend another couple of years doing fellowships to actually get my surgical skills up to scratch. Innovations from the medical device industry and so on continue to drive surgery forward, meaning that even expert surgeons like Sanjay and Krishna need to maintain their skills and learn new skills continuously. And just giving an example from the US, workforce estimates are that, you're going to be short 50,000 surgeons in 5 years. So when I say crisis, I'm not, overestimating the situation that we're in. Moving on to patients. Obviously, patients have changed as well as the surgical profession. We all know that patients come to see us now with much higher expectations. They've gone on YouTube, they've gone on Wikipedia, they've done probably more research than you guys have about their individual conditions. Patients now are probably the greatest source of information about how to live with their disease processes. The number of times that I've had to quickly Google something or look something up on Wikipedia before seeing a patient in clinic, I'm embarrassed to say, is probably pretty high. But really what this means is that, there's more and more strain placed upon surgeons and surgical services. Patient populations are exploding. And, for better or worse, actually patients have much higher expectations, and making mistakes or errors is not tolerated in today's healthcare society. So we as a profession need to be even more careful that we're training in an effective fashion. And finally, let's come on to the surgeons themselves. So whether you want to call them millennials, Generation Z, digital natives, the surgeons who are coming through the training programs today are very different than even myself or probably Sanjay and Krishna as well. I bet, I'd be willing to place a bet that everyone in this room has a smartphone in their pocket, and that everyone would feel absolutely horrified if they accidentally left it at home that day. Most people would rather leave their credit card and their car keys at home rather than leave their phone with that attached to it. I can't remember the last time that I phoned up and booked a taxi or had to think in advance about, I'm going to Heathrow on Wednesday, I better book a taxi before they will get booked up. Now I just think about it, I'm going somewhere, let's use Uber. I can't remember the last time when I had to plan what time to have dinner because I want to catch X Factor on the TV. Now it's just, ITV player, Netflix, all on demand. Surgeons of today live a huge part of their lives on digital platforms, social media, Facebook, they WhatsApp their friends. We have some interns in our lab at the moment who, I'm embarrassed to say, don't even know what a CD-ROM is, right? They're like, was there anything before a flash disk? What's a floppy disk? You're taking them through Microsoft Word, and you're saying hit the save button, and then you realize they don't even know what the icon actually means. They know it means save. They don't even realize that it represents a floppy disk. These people have really, really changed. And And it is much more of a demanding, user-driven experience that these guys are looking for. They're used to using Uber, they're used to using Facebook, they're used to using all these wonderful apps and services that are really centered around the best user experience. And I think, surgical training isn't exactly the best user experience. So there's probably a lot that we can do in terms of adapting our training technique to really meet the needs of the next generation. And like I mentioned, these guys are already using what they can from a digital point of view. I remember using YouTube a lot. Sorry, Sanjay, I did. Before coming into the operating room with you. Wikipedia has become, a lot of people's go-to source rather than Bailey and Love. Digital textbooks, the AO surgical reference, all kind of live in your pocket, which means you can get your knowledge when you need it, on the job, at the point of care. And really that's where I think that training should be going. So, when it comes to kind of us at Touch Surgery, the way that we approached it was that, well, if we're really going to make an impact on global surgical training, if we're really going to change the lives of people around the world, how do we do this? And, there are a lot of amazing simulation solutions out there, and they will all have their place in the training program, I'm sure. But what we didn't want to do was to go and spend a few £1 million building the best haptic, feedback, realistic flight simulator, surgical simulator out there. That would end up sitting in a simulation lab somewhere under lock and key. What we wanted to do was to create a solution that can literally touch every single surgeon on the planet in a very short space of time. And to do that, essentially we came up with the concept of touch surgery. I don't know whether any of you in the audience have kind of heard about it before, but I'll go into it in a little more detail now. So, Touch Surgery is a mobile-based platform for Apple and Android devices. We're mobile only, we don't even work on computers. And what we do is we focus on the cognitive decision-making aspects of surgery. So we focus on making sure that surgeons understand the procedural steps and key decision points during an operation. The reason we do this is because obviously everyone knows that a surgeon needs good hands, but not many people think about the surgeon's brain. And actually, when you look through the literature, people estimate that about 2/3 to 3/4 of a safe operation is driven by surgical decision-making process rather than their technical skill. What we do is we work with key surgeons from around the world, use a process called cognitive task analysis to break down the operation into steps and decision points, combine this with our virtual human patient, and present it in an interactive fashion that allows a surgeon to walk step by step through the operation. Because it's mobile, they can carry it with them and do this whenever they want, whenever they like, to learn, practice, and rehearse surgery before touching the patient. As well as this learn function that you see up here, we've also got quite a sophisticated testing function where we remove all of the hints and actually get you to make every single decision during that procedure, which is actually a lot more difficult than you think. For example, this is a PAP flap procedure for plastic surgery. When we asked the author how many steps he thought went into it, he said probably about 20. It ended up being about 150 to 180. That's the sort of kind of level of granular detail that we go into. Really what we're trying to do is to create digital tools that will empower and connect the surgical community to make better decisions for their patients. And because we are approaching it, I guess, in a slightly different angle to how traditional medical companies would approach this problem, we've ended up developing actually quite a special team of people. So we've got about 35 people now, based out of a lab in East London, just down the road in Clerkenwell. But these guys are not healthcare professionals, right? They come from a wide range of industries with deep sector expertise in each of their industries that they're now bringing to healthcare. And I'm just going to give you a quick example. So because we knew that we wanted to create rich, visual, mobile environments, we went to try and find the best people in the business who knew about those areas. It didn't matter to us whether they knew about healthcare, but they really had to understand how to create the right sort of experience to reach the surgeons of today. So, for example, our simulation department's headed up by Michael and James. Between them, they've got 30 years of experience working in the best movie houses in the world, including Pixar in California, Sony Pictures Imageworks, Framestore. They've made and delivered many of the products that you or your kids will know and love, from The Incredibles, Finding Nemo, Gravity, Harry Potter, and so on. These guys are literally the best in the business, and now they're applying their expertise to healthcare. We've got guys and girls, in our development department who've spent years and years developing amazing mobile-first experiences in terms of gaming and so on. Again, bringing that huge wealth of experience into the healthcare arena. Our platform's been available now for about 2.5 years. We've built the largest surgical community on the planet with over 500,000 users, literally in every country on the planet. And every month the community is using us to deliver about 30,000 hours of simulation, all through their mobile. On top of this, as you can see, we work with a huge number of partners across the globe. So from the US, places like Stanford, Johns Hopkins, Harvard, over here, Imperial College, King's, and so on. And we're starting now to develop really deep partnerships with leading surgical societies around the world as well. And what these guys do is that they work with us to create amazing digital surgical curricula that's delivered to a global audience. They run independent research studies with us. I'm pleased to say that we've actually published a number of these studies now to demonstrate the validity of the platform and the true training effect of the platform. A number of the centers in the US, as you can see, have actually already started to integrate touch surgery into their formal residency training. And they do this by delivering digital content to their residents and then by accessing data that we give them access to on people's learning behaviors, their learning curves, their cognitive competence, and have actually started to use us to deliver digital certification, whereby residents actually have to prove that they understand procedures before getting into the operating room. So yeah, that's a quick summary of how we view surgery of the future and what we've done to impact it. Thank you very much.